I think we will make a start. So just to say thank you very much for coming along today. So today is all about giving you a basic understanding of behaviour change theory and how a few tips and techniques to use in your own health campaigns and communications. So really excited to have Dr. Lucy Mersch here, who's a clinical psychologist by background. Also John Paul, who's the kind of guru of all things digital from Can Digital. And I'm Dominic Ridley-Moy and run the Behaviour Change Network. So my company is very much around behaviour change training and helping organisations run behaviour change campaigns. So just to say, usual sort of Zoom etiquette, which I'm sure everyone is very well aware of. So cameras either on or off, mics on mute, please. And do put questions in the chat as we go along, and we'll pick them up after everyone has finished speaking. So I'm just going to share my screen now. So I'm just going to ask Lucy or Danielle just to confirm, can you see my screen? Okay.
Yeah, it's okay. I can see it.
That's brilliant. Thank you.
All good.
So yes, so I'm just gonna get started. So yeah, just quickly, just to say, so today is very much about giving you some of the basics and just going into behavioural theory around health campaigns and some of the things that you can be doing in your own organisations and some takeaways. But if you are interested in a much more in-depth understanding of how to apply behaviour change theory to your work, myself and Lucy will be running a behaviour change class in April coming up soon. So this is very much around how behavioural change theory has been applied in the real world, how you can change behaviours and deliver better outcomes, essentially better public health communications, and also measure those behaviours. And John Paul will be coming along as a guest speaker. So today, I very much wanted to talk a little bit about kind of behavioural science and the background and kind of where behavioural science is at the moment and the field as it is at the moment, and then just go into some tips and techniques. Lucy's going to talk through one of my favourite models, one of our favourite models, the COM-B model. And then John Paul's going to bring it all to life at the end and talk about applying campaigns in a bit more practice. So the good thing about behavioural science now is that there's much, much more evidence about behavioural science and how it all works. There's loads more trials, there's loads more really good, robust evidence, and there's more and more from across the whole globe. So it's really kind of taking off at the moment. And behavioural science, just to give you some background, it's all really about helping people to make better choices. For companies, it's about helping them to sell their products. And also, I think for me, one of the biggest areas is around helping to save the planet. And in terms of today, very much calls close to my heart, it's very much around managing demand, healthier life choices, reducing the risk of diseases like diabetes, diet, immunisations, vaccinations, all that kind of thing. And I'm going to go through a few tips that we can all benefit from as we go through the course of this session. So more and more organisations are using behavioural science, which is clearly a good thing, and it's getting much more embedded in the public sector. Lots of people are using it in central government, and more people are using it elsewhere. So this is, I think, in the sign up form when you signed up for this webinar. One of the question we asked you was, how often do you use a behavioural framework like EAST or COM-B? And the positive thing about this is this is getting better all the time. So more and more people are using behavioural frameworks in their communications, and particularly if you're from a public health background, this has been used increasingly, which is really positive. And certainly in public health, there's lots of other behavioural frameworks that we aren't covering today. So if there's one thing that I want you to kind of all take away today, and if it's not something you're doing, think when you're kind of planning your campaigns around health, especially if it's a kind of social marketing campaign, remember that human behaviour is really complex. and that we make something like 35,000 decisions a day. So there's a lot of choices we make as we go go through the day. And there's lots of things that determine how we make decisions. So emotions, what we believe, what people around us do, all that kind of thing, our socioeconomic status. These are all the things that affect our decision making. And Lucy will talk a bit more about COM-B, because that's a really interesting model to think about what happens in your environment, and something that's often overlooked. So I just wanted to say a little bit about kind of where you start with behaviour change campaigns. And as it's World Smoking Day next week, I thought I'd say a bit about smoking. So this is from a podcast that I listened to from someone who called Ruth Dale, who runs Behaviour Change Marketing, and it's a great listen. So do search for it and tune in. And I was listening to this one again the other day. It's by Kate Knight, a program director from the NHS, and she's done loads of work on smoking, and she sums up behaviour change campaigns really well and where we all need to start, which is really get into that basics, understanding why people did what they did, because if we don't understand what people do and why they do it, we can't influence their behaviour. So it's really important, and I think one of the areas that people often skip, that upfront thinking that people need to do. And I think particularly with smoking, there's this danger that we can potentially demonise people with smoking, but actually they're not bad people. It's because they're stuck in a habit. So this is one of the things that I think is really important, and something that we work through in the course in more detail, thinking about what are those kind of small, tiny changes that we can get people to shift that will have a massive, massive difference to health outcomes. And this is really, really important, because actually, if you focus on something simple and easy to move, then you'll have better results, and your campaign will be more successful, and you'll shift an area that's easier to move. So in this case, so the campaign that Kate talked about was one small step, and this was a while ago now. So it's asking people to make their home smoke-free. So what was happening was parents would put their kids to bed, and then they would have a smoke out the window. So they would still be inside their campaign, inside their house. So the campaign asked parents to change their behaviour. They were asked to walk outside the front door and smoke outside. So it was one really simple step, just one small thing that they could change. So it's easy for people to do it. It had a massive difference to people's behaviours and was really successful. And that's the thing about a lot of the campaigns that I work on. Now, I've been doing lots of exercise this week, and we'll come back to that in a bit, that actually one small simple step can often be a really good place to start. So in terms of thinking through behaviours, there's a number of things you can do to think about what it is you want to shift. So this is from the Government Communications Service, and they define that behaviour is something as an action that is observable, and it's thinking about who does what, when and how. So it's very much around starting or adopting a new behaviour, stopping a harmful behaviour, doing that thinking about what is it that we want people to do. Are they doing something new, or are they improving on something they do? What is that very specific behaviour you want to get people to shift? So this is my own model that I've developed, which is a kind of combination of behavioural frameworks and also models that all the comms people on the call may be familiar with, so things like Oasis and Rosie. So it's very much 4 simple steps you can do to plan your campaigns around identifying behaviours, thinking about what are the barriers, and this is the really important bit, thinking what stops people from doing what we want them to do, then coming up with solutions and testing it. And we're going to focus a bit particularly on Examine this afternoon. So at this point, I'm going to hand over to Lucy just to say a few words about COM-B.
Thank you. As Dominic says, I'm a clinical psychologist, and I work in the NHS, and I also work with Dominic. And today I'm going to introduce the COM-B model. So looking at the survey that Dom sent out when you signed up, it looks like some of you are probably already using this. So this may be a little bit like teaching you to suck eggs, but I also know there's people here that haven't come across this model before. So the COM-B model was devised in 2011 by Mickey at UCL and her colleagues. And what they did is they took 19 existing behaviour change frameworks, examined them, synthesised them, and put them together in their COM-B model. And when looking at behaviour, they've identified 3 domains that impact on somebody's ability to do a particular behaviour at a particular time in a particular place. And these are capability, opportunity, and motivation. And they broke these down further. In terms of capability, they looked at somebody's physical ability to do this behaviour or change this behaviour, and also their psychological. Within psychological, it's about the understanding or knowledge somebody has about the importance of that behaviour, as well as whether they've got the kind of cognitive skills and the executive functioning to be able to change that behaviour. A clear example of this would be if you're asking people, you're hoping people will change their eating habits. If they don't have knowledge, they don't have the psychological knowledge about what foods may be good for them and what foods are bad, then they're not going to be able to change that behaviour. The physical element of capability is pretty much what it says. Are people physically able to change that behaviour? So if we stick with the healthy eating example, are people physically able to cook a meal, put a meal together from its core ingredients? Are they physically able to get to the shop to buy those ingredients? The next factor is opportunity, and this is broken down into physical opportunities and social opportunity. And the physical opportunity is people's environment geared up for them to change that behaviour? But as an extension of that, opportunity also includes people's resources like money and time. I think a clear example of this is we work with families that go down quite the deprived bit of Cornwall. We're obviously completely surrounded by ocean on 3 sides in Cornwall. So people have the physical opportunity, like the seas there, they can go swimming and exercising in the sea if they want to. But actually in the areas that have got a lot of poverty, people don't have the physical opportunity in terms of public transport, money to get their own car, and maybe the time if they're both working full time. Social opportunity refers to social factors like cultural norms and social cues. So it's looking at whether people can do the behaviour that they want to do, they feel comfortable doing it based with their peer group, their family, and within their culture. The third broad domain, which I think is probably the most interesting and probably the one that I work in most in my work, is motivation. And this is split down into reflective and automatic. So reflective is the one that everybody's aware of. It's your beliefs, your values, your passion, why you want to change that behaviour. And it's really important to get buy-in from reflective motivations, because potentially we're asking people to make changes to their lives that might be initially tricky, and then really hoping they maintain them. So it really needs to tap in to how people want to be living and how they want to be living healthily. And the second area looks at automatic. And this is the things we do more habitually, or the things outside consciousness. So when we're kind of looking at making behaviour changes, we want to bring those behaviours into consciousness so people can be aware of them and then start to change them. And I know that's something that Dominic is going to go on and talk on a bit more about habits.
Okay, that's great, Lucy. Thank you very much. That was a really interesting and in-depth run through of COM-B. So I think the thing about this model is kind of it's really useful. And for me, it's all about how as a comms practitioner or someone working in public health, how can you use it to plan your campaigns? So this is my kind of very sort of simplified version of COM-B. So this is what we need to think about when we kind of planning our campaigns. So ask these questions: what, why, when, who, and where. So it's really to just get you thinking about. So if we kind of thinking about exercise, and this is something that I've been working on all week actually, so it's very timely for me. So what do we want people to do? So I've been working on a campaign which is all about, we want people to exercise more, but what does that actually mean? So is it kind of obese people? Is it young people? Is it people already doing some exercise? Is it people in their 40s? So it's very basic comms, but thinking from a behavioural point of view. So what is it we want to do? So the work I'm doing this week is very much focusing, we want people, particularly in their 40s, 50s and 60s, to do some exercise. We want them to be active. And that's something that the NHS do very well. So what is something we can get people to do? So we don't want to make it difficult. So why is really important. So why aren't people doing it already? So if you're in your 40s or 50s and you're not doing much exercise, it might be it's too difficult, it's not part of your routine, you don't see the benefits, you don't have the motivation to get started. So the more you think about kind of what is it that will nudge people in that direction, the more you can hone it down to one very clear call of action. And also think about, when can you build it into your routine? When could people exercise? And then also all the other things that we would necessarily think of as comms people. So who is your audience? Who is your advocates? But also, when do people conduct the behaviour and where are they? So are you going to have quite a defined sort of demographic? So it could be people who walk to school on a certain day or a certain area, that kind of thing. So just to go into a bit more of the science around it. So if we take exercise again, the kind of, I suppose, the behavioural theory is around it is called substitution. So it's always easier to substitute for a similar behaviour. So if someone's doing no exercise, they're not going to go to jogging. So get them to go to that next step. Or if they're doing no exercise, just getting them to walk to the shops is going to be better than nothing. So always think about having a realistic goal, and one that's easy and simple. And also doing a lot of goal setting, breaking it down into manageable goals. So if you say to someone, exercise 3 times this week, something that they can actually do and believe they can do and make a difference. And also things like, so this was a challenge because I'm really bad at using the behavioural science on myself. So I kind of set myself my own challenge, I think, last year. So, and also think about how you can get people around you to help you. So what I did was I used all the behavioural theory on myself. So it's committing to something publicly. So I think I set myself a goal of, I think it was 15 minutes of exercise at least 4 times a week. So there's me on day 1 on the rower. And we're much more likely to achieve a goal if we publicly commit to it. And also get others around us to help us. So if you have a peer group, you post on social media, all that kind of thing, but also if you couple it with a penalty for failure. So I think my penalty, I think John Paul will certainly know about this, was I think it was not to drink alcohol for a month in September. So that really helped focus my mind, and that really got me on track and helped me on that initial step, and then other goals kind of came on top of that. Also, another thing that you can think of doing is, so here's an example. I was having a conversation with someone recently about infection control. So actually, if you're working in a hospital and you're thinking about getting infection rates down, going through the kind of COM-B model using this template is really, really useful. So thinking about who is it that we want to perform the behaviour. So staff in a hospital who potentially work with patients, come into contact with people where you want to reduce infection rates is the kind of target audience. But where it gets interesting is, rather than just putting up posters and doing the usual kind of stuff, thinking about, well, what is it we want to do? So to reduce infection rates, what is the one thing we can focus on? So when do we want to get staff to clean their hands? Is it at the start of each shift? Is it after using a toilet? Is it before physical contact with patients? And then you start to build a campaign around that, because actually the point they come in contact with patients is the point when they could potentially transmit an infection. So at that point, you start to think about what is the very specific time you want to shift people's behaviours. And also habits. Habits are really important. So with everything from diet to exercise to kind of managing your diabetes, how you form a habit is something that we all really need to be aware of. So according to the most robust research, I would say that it takes 66 days to form a habit based on research from UCL. And this is a kind of 3-step loop. So if you're not familiar with what governs a habit, first of all, there's a cue, which is essentially a trigger that tells your brain to go into automatic mode and which habit to use. Then there was a routine, which can be physical, mental, or emotional. And finally, you get a reward from that habit. So that's the brain saying, oh, is this habit worth keeping? And that's how habits work. So it's basically just 3 things. And over time, this loop becomes more and more automatic. And then what happens is that cues and rewards become intertwined, and you get this kind of craving. So McDonald's do this really well. McDonald's understand that when you eat their chips, they give you that kind of salt hit, and they will no doubt have been designed by a psychologist who would have come in and advised them on that kind of thing. And then eventually a habit is born. And what happens when you have a habit is a habit emerge, is that your brain basically stops fully participating in decision making. So it's an automatic process, and that's why habits are really, really difficult to overcome. So a habit never really disappears because they're kind of encoded into the structures of our brain. So when you're getting someone to do something differently, you have to think about things like what triggers habits, or what sort of substitutes can you put in place. We haven't really got time to go into that into more detail today, but it's just something to bear in mind that it doesn't happen overnight. So if you're doing a campaign around habits, it's sustained behaviour change over a period of time. Also, I just wanted to say a little bit about if you're kind of running I suppose what I'd call a social marketing campaign or a behaviour change campaign, for want of a better phrase, case studies are really, really important. So something like 80% of our decisions are driven by emotions, and stories are hardwired into us from primeval times. So this was a campaign I worked on a number of years ago to support the redevelopment of a hospital in East London and get people on board with the campaign. And this was a really sad story. And I think the lady in the case study, her brother sadly passed away, but she was very grateful for the care that he received. And I think that's the kind of thing, that stories that have that, it could be me, that emotional pull that really resonates with people. And also, as I'm sure many of you will know, there'll be more media friendly in many ways, all that kind of thing. But I think with that, if you're trying to get people to do something at scale and take that first, I suppose, step on the journey to doing something, whether it's signing up to a pledge or making that initial step, saying to people, here's a really strong case study, do it for whoever it is you've got as a case study. That's really powerful and emotive. So I'm just going to say a little bit about measurement, and also an exciting new venture that myself and John Paul are working on, and then I'll hand over to John Paul to talk about bringing campaigns to life. So I think for me, when you're kind of measuring behaviour change, it's always thinking about when you're setting your goals and your kind of objectives, it's always thinking about, you know, how can you change that behaviour? And sometimes just watching people do things, so watching people drop cigarette butts, or things like having a pledge and asking people how many people have signed up to a pledge to exercise 3 times a week, things like that. They can be quite easy ways to measure behaviour, and then using things like focus groups for that more in-depth kind of going into things much more in depth and thinking what is really happening. Also, I'll hand over to John Paul in a second to talk about programmatic advertising, which is a really good way to use lots of different channels to to launch, to run lots of different adverts and campaigns and graphics and all that kind of thing. And one of the things I often get asked is, how do you test different messages at speed and use behavioural insights? So one of the things that myself and John Paul will be launching shortly is the Behaviour Change Test Lab. And that's basically a really quick way of testing different messages at speed. So looking at the behavioural science, looking at different messages, graphics, videos, all those kinds of things, and thinking about how can you get messages out there quickly, toss them across lots of different channels, across social media, across lots of different websites, and see what works with people and what messages resonate. And that's something that we can get out very, very quickly. And then also, one of the other things you can do is online search advertising to sort of see what people are searching for. And here's an example around diabetes. So John Paul, I think I'm going to hand over to you now, if that's okay. Did you want to talk about online search a bit more initially?
Initially, yes. So, yeah, I mean, it's hard to think of public sector or public health campaigns that don't involve behaviour change. And when those campaigns are designed, and if they don't consider behaviour change in them, they're obviously much more likely to fail. And you know, working with Dominic and Lucy and absorbing their expertise, I think is a way of establishing a habit of applying behaviour change to all your campaigns so that they'll be more successful. Yeah, I went on a course with Dominic quite a while back, and it really changed my thinking around how we design messaging, how we use insight to design campaigns. A very common habit of the public sector is to spend a lot of time designing a web page, messaging and things like that, and then consistently fail to amplify that message to the target audience with sufficient targeting, with sufficient volume, which kind of means the whole thing has this damp squib effect where you sort of do some stuff, send out a press release, maybe do some organic social media posting, and then you look and you see that nothing's happened. And I specialize in that bit, which is making sure that when you've done all this good work, you've thought through the easy calls to action that you want people to make to change habits and establish healthier ways of living their lives, or using the NHS in a more responsible and efficient way. We use digital advertising to put that in front of people at the right place at the right time. The wonderful thing about now and being a communicator now versus maybe 2 decades ago is that the way people consume information has changed totally. Much more digital, it's much more online, it's mainly through their phones, we all know this. But the wonderful thing for communicators is that digital media is much easier to target. So search advertising, for example, lets you see kind of what people are thinking about and what concerns them and what they're trying to find. Being able to place a message next to search results around health checker, for example, for NHS health checks is a lot better than putting some stuff on the back of a bus. Putting ads around content on YouTube about fitness and things like that, or reducing weight, and linking them to a local walking group or a subsidized pass to a local gym, much more effective than doing a radio ad on a station that might be listened to by 12% of your target audience once a month. So this technology, programmatic technology, enables us to place messages in the right place at the right time in front of exactly the right people. So you can constrain geography, you can constrain demography. So you can, for example, focus in on low-income households that are searching for issues relating to diabetes. If you don't mind, I just wanted to show a little bit of the kind of insight you can get before you even plan a campaign. We run these sorts of checks. So this is about demand management, and we can look in a certain location what people are typing in on Google search around certain conditions and certain things that might indicate they're about to head to A&E. And we can then see the trends and then work out what messaging we want to focus on. So this is a really good way of getting that initial insight to identify where you want to nudge people towards. We also look, for example, about mental health many of the drivers of mental health issues. And we can then look at a certain location and see what are the trends, what's at the front of people's minds. This is a bit of a big inquiry. It may break, or it may work. But this ability to look and then to design campaigns that target the number of people who are at risk of having the situation you're trying to fix, and then nudge them towards simple actions that they can take is unique and very powerful. So applying this technology, applying it at scale, is something that's really exciting and quite unique to us. I use this table a lot. When someone comes asking you for a way of amplifying a campaign, you can gently nudge people towards things that work better, and away from things that work less well, and design campaigns that someone's just said, how do we link our campaigns to searches? Well, when you search for something, sorry, Dominic, I'm just going to share again quickly. This may not work, but I'll give it a go. So if I put diabetes symptoms into Google search, there's a lot of different ads. Sorry, there's a lot of information that comes back. Often we don't want people to dig into those things because the Google doctor is an issue, but there is the opportunity to put adverts at the top. So you see this sponsored one. This is from diabetes.org.uk, but that could be your local NHS diabetes service, or nudging you to maybe go and have an appointment with your GP about diabetes. So every time something is searched for, there is an opportunity, for example, trouble sleeping. There are opportunities like this one here, for example, the Mayo Clinic, to place adverts amongst those search results. The same. Oh, am I not sharing my screen? Sorry. Can you enable that, Dominic?
Yeah, it's not coming up, JP.
Oh, I'm really sorry. Are you seeing anything that I've just been talking about?
Saw the coloured table.
Okay, Dominic, can you let me share my screen?
Yeah, so you should be able to share now. Apologies.
Okay, so sorry. What I was talking about were these sorts of graphs where we can see trends in all sorts of different areas. So I'll just quickly show you this one on mental health again. Apologies, I thought I was able to show all this. So you can see what people in a certain location are looking at on search, and then when this shows up, it'll give them an apologies. I've really mucked that up, haven't I? When are we looking at a map at the moment now?
We are.
Yeah, all good.
Good. Okay, so if I put in diabetes symptoms into Google, there will be a range of adverts potentially that can appear around it, or trouble sleeping. We sometimes see sponsored adverts around certain things. So that's how you can intercept search. And then we can also look at, for example, live demos, man, never do it. We can look at what the volumes are in your area. So if anyone wants to see how that works and how it helps you guide what you're doing and how you plan campaigns, then I can send you this and I'll show you it separately. But in short, Dominic, can you share your thing again?
Yeah. I mean, I think what I'm just going to say really quickly was that I think what that was really helpful for. So I think I ran a campaign in a London borough at the kind of as the tail end of the pandemic, and we found that we wanted to see what the concerns were, what the health concerns people had were, and diabetes came up quite strongly. So we could see the kinds of things that people were searching for, because as the organisation I was working with had lots of things that they wanted to focus on, but actually diabetes was one of the big things that people wanted to kind of search for. So I'm just gonna.
Can anyone see this at the moment? This is just local search volume around things that might cause mental health issues.
Yeah.
That's showing at the moment. So this just helps us contextualize and maybe focus on the things that are worrying people. In London, unsurprisingly, concerns around finance are increasing, sleeping and anxiety cover about half of all searches related around mental health. That helps you understand where you need to focus your messaging. Apologies, Dominic.
Okay, I'm just going to try and share my screen again.
Dominic, did you want to answer? There's another really good question in the chat. Will you come to it at the end?
I could take that now while I'm just sharing my screen. What was the question?
It's from Josephine, and it says, I've seen commitment applied really clumsily to campaigns that centre on people getting to make a pledge, but they tend to preach the converted. How do we avoid these pitfalls?
I mean, I think, yeah, I think that comes back to, there's a number of things I'd say, and it comes back to what I was saying earlier. So I think it's been very clear about the behaviour that you want to shift. So the campaign I was talking about earlier that I've been working on this week, we've kind of come to a place where we've got a very specific demographic, and we want to get them to pledge to do something very specific. So it's around being kind of active. So doing some activity and basically looking at how to combat things like diabetes, heart disease, picking people in their 40s and 50s, and then thinking about how we can actively target those people to go from no exercise to some exercise, and then working with them to make a pledge. So that initial part of the campaign will be very much around what can you do, how can you build in being active, say 20 minutes a day, something easily achievable, and that's kind of the first part. And then I think with these things, a simple call to action is good, but actually with a lot of these things, it's how you sustain that behaviour. So the next part of the campaign is that's that face-to-face intervention, working with someone saying, what's the pledge that works for you? But then also thinking about other things as well. So it will be things like, you know, how can you use your friends, family, neighbours? How can you make a commitment? How can you keep that going? How can you reward yourself so it becomes a habit? So that's kind of how I would approach that. So now I'm just going to share my screen again and hand back to John Paul. So I'm just going to
Thank you, Dominic.
Move to the next slide.
Yeah, so this is the idea. The people that you want to reach are probably looking at using a range of different digital channels: news, video, YouTube, social, even navigation platforms. The audiences that use will be spread differently across different. So, you know, older audiences will trend towards Facebook, younger ones you'll find them on Snapchat and TikTok more reliably. But designing the right messages for the right channels, we can help with that. And with Dominic's new service, we can test what works on what channels as well. We can also use, being public health communicators, data from each other's campaigns to help. So sharing data between public sector campaigns, again, is really a powerful way of building collective intelligence. Can you move the slide on for me, Dominic?
There we go.
And the absolute dream goal that we're trying to get to is, because the media is measurable and now many outcomes are measurable with, you know, people taking steps online, signing up to things, using fitness apps and things like that, we can measure in red communications interventions followed by, in blue, health outcomes. And demonstrating this to people and showing what works, and also optimizing how we do that over time, is something that's quite new and brilliant in terms of justifying investment in public health communications. Because if the people with the budgets can see this stuff and can see that you've designed campaigns using behavioral science, that you're then implementing them in a way that other people can see, and then measuring the correlation between your communications interventions and the outcomes, it becomes much easier to have sustained budgets and therefore sustained campaigns that get more and more efficient over time. A common criticism I give is that we sometimes do too little, too late for 2 weeks, and expect something to happen. What you actually need to be doing is having gentle, always-on behavioural nudge campaigns using the messages and the insights that you get from working with Dominic and Dr. Mersch around, and then applying those in the right place at the right time all the time, so that we can nudge people to go to pharmacies in the spring and the summer so that they don't go to A&E in the winter, so that we can nudge people who might be having sleeping difficulties towards having some sort of talking therapy around stress and anxiety. All of these things means that we can provide mechanisms, communication mechanisms, that help us address healthcare problems exactly, you know, at earlier stages, which is what we really need to be thinking about in terms of supporting people and having healthier, happier lives. That's it from me, Dominic.